Welcome back to the show. It's not the type of cosmetic surgery you typically hear about, droopy eyelid corrections, or how about brow lifts. These elective eye procedures are becoming more and more common, and our next guest says that they can not only improve your appearance, but also your sight. Optometrist Dr. Gina Wesley is here now to explain. Hello, Gina. Good to see you again.
Good to see you, Rob.
Yeah, when I first saw this segment, I just quickly assumed it was refractive, LASIK, something like that, so you wouldn't have to wear glasses when I saw cosmetic, but that's not the case. We're talking other things.
Yep, there's a lot of different procedures that people can have done to enhance not only appearance of in and around the eyes, but actually things that we can do to help their vision, just as you mentioned.
So there's all kinds of things, bags under the eyes, droopy eyelids, things in that. Is that caused by hereditary? Are they hereditary, or is it environmental, or just time?
It's a lot of age-related conditions with the sagginess and droopiness of the skin. There can be injury or trauma to the eye that can play a role, so environment certainly can play a role. Oftentimes it's a combination of both. Okay,
I've got dark circles and bags. Can you fix those? Yeah, more sleep. That's more sleep.
Thing.
That's how we fix it. Okay, let's re-examine the droopy eyelid correction and specifically talk about that a little bit. We have some photos to show what we're talking about.
This is a good example of age-related eye droopiness. A before and after picture. You can see that surgery has really brightened up the eyes and actually gotten those eyelids out of the way, so his vision isn't being impeded anymore, especially above. His vision is now much more back to normal, much more functional, and it looks a lot better.
Okay, what do we got here?
This is another example, and you can see there's just that sagginess from the eyebrows and the eyelid skin dragging. And oftentimes when they do a repair to the upper eyelids, they often have to lift the eyebrows as well so that everything moves and flows and looks natural after the surgery is completed.
Oh, okay. And a lot of these could be considered medically necessary. So even though they're cosmetic, the first thing I think about is, wow, insurance might pay for this.
Exactly. So this is a good condition. It's called entropion. It means that lower eyelid, as you can see, is turning inwards. And actually those eyelashes can cause lots of problems by scratching the front surface of the eye.
The bottom. Okay, I see it. I was looking at the top, but so the bottom. Okay, I see that.
This is a different one. Here's another example. So as you can imagine, this can be quite uncomfortable for patients. And this usually is a very easy surgical repair, and you don't even know that the surgery has happened. The cosmetics of it are really nice, and the patient looks
very
normal.
I get an eyelash in my eye and it drives me nuts, and these people have to live like this all the time with that eye. Okay.
So here's an opposite example. This is called entropion. It means the eyelid is slowly turning outwards, and this is more of an exposure problem where this patient's eye is more likely to get infected, it's more likely to be dry, it's more likely to have lots of irritation and complicated issues because it's constantly turned out and exposing that nice delicate tissue of the eye.
Is this an outpatient procedure, or are you going to spend a couple days in the hospital?
Yep, nope, this is an outpatient procedure. You would go in and have the surgery done. You'd be home the same day. You do look like you have maybe a little bit of a black eye once the procedure is finished, but it's very much worth it for you to be able to have not only normal, healthy, functioning eyes, but a much more nicer appearance.
What's the procedure? You make an incision, and is it just a quick little incision and a pull?
Yep, most of the time they have to maybe sometimes remove excess skin. They work with the natural creases of the eyes, which is nice because you can hide a lot of the scars so that you can't tell that the surgery has even been done.
And then recovery time?
Recovery time, usually about a week.
Oh, wow, that's nothing. And usually a lot of those, it looks like you'd have a lot of discomfort living that
Absolutely,
way.
And it's kind of a constant medical condition that you need to be applying drops or ointment to keep it healthy. So if you can take it care of so that your eyes can take care of themselves naturally, it's a much better win-win situation for everybody all around.
Okay, now we're talking droopy eyelids. How about growths on eyelids?
Yep, there certainly can be significant growths that people have, both benign or malignant. And sometimes when those growths need to be removed, a significant portion of skin or tissue has to be removed along with it. So it's important to make sure that you can repair that skin and tissue so it not only looks normal, but is still functioning and keeping your eye healthy.
Okay, the first step for someone obviously would be call their optometrist and schedule a consultation. From that point on, if you were to say, yes, let's go ahead with the procedure, what are we looking at for a time frame? How long does it take?
You know, a time frame, it just depends on, who you're sending this patient to for the appropriate referral. A lot of times they're plastics consultants and people who work specifically with the appearance in and around the eye. Usually people can get these procedures done relatively quickly.
Will it come back? Will the droopiness come back?
It possibly could.
Okay.
Sometimes, especially people who have the droopy upper eyelid, that sagginess might come back, especially if you have that surgery earlier in life.
Very good. Dr. Gina, thank you so much.
Thank you,
Wonderful
Rob.
information once again. Look forward to seeing you again. For more information on Dr. Gina Wesley and any of the things we talked about, visit showcaseminnesota.com and click on the Tuesday link.